Healthcare is a necessity, but for the 133 million people in the U.S. who suffer with chronic diseases, quality healthcare is also far too often a luxury. Just ask Linda, a 42-year-old woman recently diagnosed with multiple sclerosis. Linda's new treatment protocol has come with a range of health-compromising side effects. All of her symptoms indicate she's moving in the direction of a possible stroke or heart attack. Linda calls her doctor's office repeatedly, but is eventually advised to visit the ER when her doctor's unavailable. Fast forward 6 hours later, and Linda's home from the ER with a simple medication adjustment and a big hospital bill. Miscommunication or lack of communication between doctors and patients steals dollars and lives. Linda's avoidable ER visit and those of other chronic disease sufferers claims $14 billion each year, and it doesn't stop there. Let's step back and look at the bigger picture. $100 billion is lost every year when patients like Linda are unable to adhere to treatment. About $25 billion is spent on unnecessary readmissions to hospitals, most of which are avoidable. Linda's case had a bittersweet ending, but many people with chronic diseases opt not to visit the ER, their health states rapidly unraveling into deeper, more complex scenarios. Linda and patients like her are dependent on making calls to the doctor that either go unanswered or just get lost in the pile somewhere. By the time the physician gets the message, it may already be too late. Patients are often advised to take unnecessary trips to the ER. The physicians, on the other hand, are extremely busy and are constantly hammered with phone calls. So it's not uncommon for Linda's doctors to return her phone call 6 to 10 hours later. I'm Your Doc will change all of this. By bringing back the good old doctor-patient relationship, Linda and millions of patients like her won't have to spend unnecessary dollars on useless visits, and doctors can get in touch with their patients when they're needed. I'm Your Doc is an innovative platform where patients have direct access to their own physicians. With I'm Your Doc, physicians will be able to increase the revenue of their practice by getting paid for services they're already providing. Healthcare insurers will see enormous savings in preventable readmissions to the hospitals. Linda and the other 133 million sufferers of chronic disease in the U.S. will rest easy knowing their wallets and their health states are being monitored. So how do doctors and patients like Linda overcome this communication gap? By registering at our website, imyourdoc.com, or downloading the I'm Your Doc app on a mobile device and registering. It's as simple as adding your doctor to the chat list and staying in touch. I'm Your Doc is also HIPAA and high-tech compliant. This means all patient information is fully safe and secure. It's that simple. I'm Your Doc, evolving medical care to a whole new level.